which doesn't have the largest projected deficit by any means. Spending on acute care is projected to fall in nominal terms over a 6-year period, despite a population which is both increasing and ageing, and cost pressures such as the sharply rising cost of drugs. STPs have made an assessment of their own deficits by 2020-21. Researchers have disclosed that approximately 29 of these 44 STPs have projected substantial deficits. At a minimum, I have to make some progress.
Point of order, Mr. Fuller.
Deputy Speaker, is it a requirement of a member of this House to know the difference between a debate and a monologue?
It's for me to make that decision. I'm quite happy. For the minutes, the Shadow Secretary of State to decide whether she wishes to give way or not. In fairness, it is the opposition debate and she is leading that debate. So please, let's not have any more pointless order, because I'm very worried about the numbers on the list and I want to try and get everybody in. Diane.
So when the STPs talk about efficiency, they actually mean cuts. And increasingly, at the heart of these STPs are asset sales of land or buildings to cover deficits. No wonder the leader of Hammersmith and Fulham Council, Cowan, has said that his local STP, this is about closing hospitals and getting capital receipts. He goes on, it is a cynical rehash of earlier plans. It's about the breaking up and the selling off of the NHS. And the King's Fund has said, I have to make a point. The King's Fund has said, there are some concerns that NHS leaders have focused their efforts on plans for reconfiguring acute hospital services, despite the evidence that major acute reconfigurations actually rarely save money and sometimes fail to improve the quality of care. The BMA has said the same thing. And the King's Fund has said the cuts under the STPs are eye-watering. And the Health Select Committee, I'm anxious to complete my remarks so you can all get a chance to intervene. And the Health Select Committee's recent reports about the impact of the 2015 spending review stated, at present, the Sustainability and Transformation Fund is being used largely to sustain, in the form of plugging provider deficits, rather than in transforming the system at scale and pace. If the financial situation of trust is not resolved, or worse, deteriorates further, it is likely that the overwhelming majority of the STP fund will continue to be used to correct short-term problems rather than support long-term solutions.